name is Dr. Aime Idahosa, aka Dr. Minx. Welcome to Minx Talk. So today we have a very special episode for you because I have a special guest. This is my brother, Osadolor Idahosa. Introduce yourself.
How you guys all doing? Osadolor Idahosa, sometimes go by Osas. I'm here today because of our talk. You invited me over.
What do you do?
I am a counseling student at Indiana Western University. I work at a physician's office right now, but for this talk, I'm coming from the counseling perspective.
Perfect. So you also have a undergraduate degree in
psychology. Yeah.
Perfect.
I guess I should have said.
So today's topic involves mental health, and I think it's important more than ever right now because of what's currently happening in our society and our community with the passing of George Floyd. Well, not passing, with the murder of George Floyd, and the protests that's happening after that. So I think it's really important that we address this topic. And again, this also goes beyond just what's happening right now. I think mental health in general should be addressed more publicly, and we should really take steps to advocate for ourselves and other people in terms of mental health. The first things first, what is mental health? I think when it comes to healthcare, we think about our bodies, someone's sick, is someone injured, is things of that nature, but we don't think of the mental. And I think I really want to urge us to really take it seriously, that our mental health and our mind and how we're feeling, I guess that's the way to put it, how we're feeling is equally as important as how our physical body is doing. So for example, people have anxiety, people have depression, people have other psychiatric and medical problems that is just as important and can take a toll just as much as physical body illness. So that is what mental health is. I really want to take time with people to really destigmatize mental health, because lots of people tend to feel small, or they don't feel as strong because they suffer with anxiety, because they struggle with depression, or because they struggle with other mental problems, and they tend to feel embarrassed, or they shy away from discussing it because they feel like it's not really a medical issue, or they feel like, oh, I don't want to be embarrassed, or that's for crazy people. And that is most certainly not the case. I really, really want to stress in this because how important it is to, one, be in touch with yourself, two, advocate for yourself and actually seek care when you need it. You want to talk more about that?
Yeah, absolutely. Everything you just said is so true about how people have some stigmas, have some fears regarding taking care of their mental health. Like I said, I'm going to provide to you, I'm a clinical mental health counseling student right now, so this is what I study, so I do. So to combat, or to talk about this, first of all, from counseling, so counseling basically, right out of the American Counseling Association, the ACA, counseling is a professional relationship that empowers diverse individuals, groups, families to accomplish good mental health, wellness, and career and educational goals. And that also deals with handling and treating mental and emotional disorders. So I want, for the main point of the stigma around it, I know it's a lot, but there's just so much to talk about, because I talk about it so much all the time. To talk about the stigma, what I should stress, first and foremost, we get paid to do this. You know how you have the doctors, this is actually our job. So we study these things, we talk about this, we are paid to help you accomplish that good mental health, that good wellness. This is our job, we are trained, we study this is all we do. And two, we see this every day, every hour. We deal with counseling. So if people that have those fears, they need to understand that we see this every day. It's not weird to us, we're not judging you. We get paid to do this. We're not doing it for fun, we get paid. So that's people have to understand that there's trained professionals that study this, and that we do this every day. There is nothing weird to this. This is what we do. So we can provide that help to accomplish good mental health and wellness. You know what I'm saying? That's from a counselor perspective.
Exactly. There's a professional service that's available to you, which again should stress how important it is that we actually have people that do this for a living. So that's how important mental wellness is, and how important is your mental health is. In my opinion, I feel like if everyone could afford it, everyone should have therapists, because people, we as human beings, we go through a lot in life, especially right now, and it's good to have someone an outside person, or could be inside into who you talk to in your family, to kind of listen to you and kind of help you navigate your feelings and help you figure out the next step forward. I think it's just really, really important, because sometimes we just can't break the cycle of anxiety because it's all in our mind. Whereas somebody on the outside can help us put things in perspective.
Yeah, and what you said was another thing I didn't know if I wanted to talk about it because we have a limited time. But just a quick point. What you said perfectly. It's an outside perspective. We're not your, a lot of times you don't know who to turn to or whatever. We're not your friends coming in. Yes, we're gonna build a great therapeutic relationship, but we're not your friends coming in. So we don't know all these others. Like it's good to have that fresh, new, different perspective coming in, different helps. That always helps too with people coming in that feel like they don't have anywhere to turn to. So.
Exactly. So from my perspective, like what I do at work, so I see patients that have anxiety, depression, both. I also have patients who have mental disorders that are more in schizophrenia, schizoaffective. I see all those patients. Mostly though, what I typically manage in my clinic is anxiety and depression. And I think it's important to know what tools you have available for anxiety and depression. So of course, when you come see me, everyone always thinks that I recommend medication. Which, don't get me wrong, I have medications that I can recommend and I can prescribe. However, it's really, really important that we also think about counseling and therapy. I think therapy is underutilized, and then of course, in some places it's just not available because again, it's a very high demand specialty therapy, like psychiatric. That's very in demand, so it's just not available. So if you can get some therapy, I absolutely recommend therapy. I recommend them to my patients, or at least just behavioral health counseling. So we have, in my clinic particularly, I'm lucky enough, we have a behavioral health counselor in the clinic, so he sees our patients I think every Wednesday. He sees in the morning, they go through like anxiety tactics, like things to do to anxiety. They go through, they read, or they go through behavioral modifications, just things that can help you, manage anxiety better, and also cope and manage your depression. So they go through like step-by-step simple tactics to help you. And then I, on the other hand, can also go through medication, because I don't have time to necessarily do counseling in like a 20-minute visit, but I can of course see how you're checking in with you, see how it's going, and then type in your medicine. So in my opinion, having both is phenomenal for your mental health. So having therapy after, and if you need medications, not everyone needs medication, but if you need medications, having medications is amazing. And then again, I really want to stress how you're not crazy for having medications for mental health. If somebody had cancer and they have medications, you wouldn't call them crazy.
Absolutely.
So why would you call someone who's on medications for their mental health crazy?
Yeah.
Like I cannot stress enough how important it is to care for your mental health. Because I feel like you can be sound of body, but if your mental health is not sound, you really can't get things accomplished. And I really want you to feel okay. You can have anxiety. You can have depression. It is okay, but what are you going to do forward? Pushing it aside and like pretending as if it's not there, it's not really helping. Going to see a professional, a counselor, a doctor, to have someone help you is incredible. And I think it's what we need to push for. I think one of the best things that worked out is when I see a patient like one day and they're coming to me and they're depressed or they're anxious and you just can't tackle. I give medicine and then I see them a month later and they're better. Like I think for some reason, and again, not everybody has the same story. People it takes a little bit longer to get better, but some people they react so quickly to medication, and it's so crazy because I have seen a whole 180 with antidepressants or anti-anxiety medications. I have, and it's like people come to me and they're like, oh my gosh, I feel like a normal person now. I'm better, and to them, being normal was never a thing, but they haven't felt that way in so long. Yeah. And so it's really important that you check in with yourself, see what you need, and talk to someone. If it's your primary doctor, talk to your doctor. Your doctor can then recommend therapy. Or talk to a friend who can recommend therapy. But I think it's important. Reach out to sources around you for therapy. And if you ever get to the point where you're feeling suicidal or you're just feeling like you're just contemplating ending your life, I want you to pause right there, because again, you're not crazy, but that is a mental health emergency. This is where you have 1-800 suicide.
The suicide hotline.
Suicide hotlines. Yeah, you can find it at the end. And then there is again, if you have a doctor, go to the emergency room. So you go to the emergency room and you tell them how you're currently feeling. They have resources and they're equipped to help you. So I really can't stress out how important it is to just seek help. Seek help, and someone can find a way to get you help.
Yeah, and it's confidential.
Exactly.
It's confidential. It's not. This is just like how we take your medical, any medical problems or records very seriously with the laws. This is we cannot break confidentiality. We cannot, like anything, again, from a counseling perspective, anything we discuss, we cannot break. The only time we can even breach confidentially is if it's a threat or harm to your life or to somebody else's life, to their health, life, or safety, or like sexual abuse to a kid. That's the only other than that, it doesn't matter what your disorder. It is not everybody's. It is not the world to know. It's between you, and we're here to work together to treat it or to work with it or to recover. So confidentiality, it's so important, and I think that sometimes keeps a lot of people from going in. And I want people to know that it's like just like how we have our code of ethics. We will,
Yeah.
if we discuss it and go out about, we can lose our licenses. And I'm sure you, in the medical field, you can't discuss medical records. Everybody knows that. Yeah.
Not. So exactly, that's good. people again feel embarrassed, or they feel like they don't want people to know, and it is confidential.
Yeah.
Also, I want to discuss some quick things that we can do right now, right, in this current social climate. As we know, if you know me, I love Instagram, so I'm always on Instagram. But Instagram recently, the past 2 weeks, has been a place of anxiety and has been a place of sadness and worry, and also again hope. There've been peaceful protests happening. People are fighting for other people fighting for their neighbors. People are using their voice and they're speaking out. But all of that can be overwhelming to some people. And I wanted to talk to those people. Or if I'm talking to you, I do not want you to feel weak or as if you're not good enough just because you just cannot do what's happening right now. I feel like it's important to that everything that's happening. It's okay to be a little bit selfish.
Of course.
If you have to delete your Instagram, delete your Instagram. I have to mine for one day.
I do it all the time.
Yeah, I didn't mind. But if you know me and I have Instagram, that's a big. I was the whole day. I just couldn't do it anymore. So I deleted them. I need time for my brain to calm down. So I don't want you to feel weak, or I don't want you to feel as if you're not doing your part because you just need a break. I think it's important that you use your voice and you talk to your friends and family. But also, if you need a break, it's okay to take a break from Instagram, from social media, because right now people are posting lots of triggering videos, and of course, what we're happening right now, it's really sad. So if you just, especially if you already have a because you're not fully well and you kind of already have a mental health that's compromised, right now, it's not the time to be on Instagram 24/7. So if you need a break, perfectly acceptable. No one's looking at you, and if people who are judging you, this don't matter. Honestly, at the end of the day, it is your mental health, and you need to be a little bit more selfish with yourself.
Yeah.
You deserve to have good wellness.
That's
so
true.
that's what it takes, and that's what it takes.
Yeah, that's very true. I mean, like you said, Instagram can provide a lot of hope sometimes. There are, those good videos that really get you going, that get you doing this. But you have to understand, there's also those bad videos at times.
Exactly.
Like, these aren't, it's like how we're talking about professional help and, studied, research, evidence-based. Instagram is not that. Instagram has good things, but it's not those research stuff and evidence-based. And with all this stuff that is going on too, like, people, first of all, everybody's tired of the racial inequalities and the tragic killings of Breonna Taylor and Ahmaud Arbery and George Floyd, or just all this stuff going on. And I feel like right now, a lot of people are sharing so much because they're trying to help, and they might, we talk about getting down by sending a triggering video, but people might also just be so new to this, to being active. Like a lot of times, or this is like our first time being activists in a way, sharing this much.
Yeah.
So it's okay, it's a new job, but it's a hard job, and it's a very real job. So it's okay, do check-ins on your mental health. If you need to take a break, take that break. Because it's not, we know it ain't easy. It's never easy to take for something right. So, but really take care of yourself.
You really can't, be the best activist you can be if you're not mentally well.
You can't.
So I think you need to take care of yourself.
You can't be any the best.
Make sure you're doing good before you can actually do good.
Exactly.
To actually fulfill your purpose and be purposeful, you need to be mentally at the right place.
Exactly.
Does that make sense? Yeah.
Yeah, that's for sure.
Thank you so much for watching our video. I really hope we were able to stress how important it is, mental health is, and what you have available. You have counselors, you have therapy, you have medicines, you have doctors.
So
you can literally go to the ED if you're having any issues, and they can help you in some way. Again, preferably if you're having not an acute emergency, we say go to your primary care doctor. But if you're having an acute emergency, mental health emergency, go to the emergency room. They can help you. Yeah. There are tools available within the system, within the health community, that are there to help you. That's right. Please utilize resources, and please check in with yourself to see if you're not quite feeling right. Talk to somebody.
And one more thing. And don't be scared to ask questions. If you're not still sure what to do, or if you want to go somewhere, remember, you can call these agents. You can call a mental health agency. You can call a hospital and ask questions, because it's a little. We all have uncertainties and stuff like that. So you want those eased out. You can call them, and they will help you put it at ease. Any question you might have, and if that's not for you, then it's not for you. If the answer is not, at least you can. Don't be scared to at least call.
Exactly.
So
exactly, because in my state particularly, there are centers that do different things. There's centers that do alcohol withdrawal. There's some that do and then depression. So if you have a question, see if it's the right place for you, call them. See if they have services that can help you. If they do tell you, they will tell you.
Yeah.
Some do in-house counseling, where you stay there for weeks. Some do you come in every day for counseling, or like every
Yeah,
other day.
outpatient.
Outpatient counseling.
Yeah.
So it kind of just depends on what's right.
So many things.
So call, ask questions.
And I know you got the counseling guy, who advocate for counseling so much, and I also do want to say this last one before I know it gets short up on time, and especially in this modern age of what's going on right now with the multiculturalism that's going with racial issues and stuff like that. I know you're gonna be getting mad. I'm advocating too much, but these counselors, a licensed mental health counselor, LMHC, like they are trained to have multicultural competency. We study these things. Yeah. Like, I don't want to go too long into this, but trust, like, even in my first year in the program I was in whatever, even if it was a techniques class, if it was a research class, if it was the history class of the foundations of clinical mental health, a groups counseling class, there has not been a time we didn't spend addressing it to different racial groups and different racial identities. And on top of that, we take multicultural classes, that the main thing is multiculturalism, and then how does techniques go involve it? How does it affect statistics? How does it affect this? All this play a pack, all this play a role. We know about anti-racism actions that you can take. We know about integrative awareness. Well, very known psychologist, Dr. Sue, talks about integrative awareness, about knowing yourself as a racial being, identity, like accepting, like knowing your racial identity and your culture, and understanding privilege and other and social political things that regard racism. We study these things. We literally study this and appreciating racial diversity. We know about anti-racism. Everybody talking about this anti-racist. One of the classes we take, we learn about commitment to anti-racist actions. How to reject racist jokes, how to be immune to social pressures that can pull you back away. Like, so long story short, we study these things. So like, they know they would know, like, I'm just saying it's really important for this day. And I'm not saying don't only go to counseling because, or just for this situation. I'm just saying in this day and age, because it pertains to so much what's going on right now in our world, but that they are trained in this area as well. Yeah. But again, there's a lot of different reasons you can go to counseling for. Yeah, so. Absolutely.
Or anything. Yeah. Absolutely. Anything else?
No, my bad. No, my bad.
No, I think that's important. I think that's why I wanted to have conversations.
Yeah.
You can offer a different perspective than what I can offer, where I take patients like different medicines and they recommend counseling. And so you guys can tell us what happens in counseling that I recommend. So I'm happy you were able to come drive all the way here for this video. Thank you so much.
Because I love you, sis. That's what it is.
I am lovable. Thank you. Thank you guys so much for watching. If you have any questions or concerns, please leave them a comment below or DM me. I can try to get them as soon as I can. Stay tuned for the next Talk video. Bye.
Take it easy.